Tu nombre y un poco por qué, cómo estás aquí, cómo llegaste.
Mi nombre es José Mendoza. Estoy aquí porque soy inmigrante de Oaxaca, México, y vinimos aquí en este país en el 2004. Allá hace mucho tiempo vinimos como corriendo por la pobreza, tuvimos tragedias en nuestra vida y que nos hizo venir aquí a los Estados Unidos. Y vine aquí a los Estados Unidos con la mentalidad de trabajar y luego algún día regresar, ¿verdad? Tengo familiares que todavía siguen con esa mentalidad y no, para mí no, eso no cambió hasta hace unos pocos años. Ya soy una persona adulta y todavía pensaba así que tengo que trabajar lo máximo posible porque voy a regresar, pero en realidad no voy a regresar porque ya son casi 20 años. Y es algo de que estoy estudiando psicología ahora y quiero hacer como un research para decirle a los hijos o a los inmigrantes de que sí es bueno recordar de dónde vinimos, pero quizás muchos de ellos no van a regresar, hay que hacer una vida aquí y hay que pensar en ahora, no solo algún día voy a regresar. Pienso que es algo que me motiva a trabajar con la comunidad.
Ah, qué bueno.
Voy a subirle el micrófono un poquito, David, nada más. Está un poquito bajo.
Y como te dices, perdón, pues muy bonita tu historia.
Uh-huh.
¿De qué parte de Oaxaca eres?
Ahora que haga esto.
Oh, sí,
Y después va a hacer esto.
Nomás
Ahorita
para
yo le digo
manejar la
cuando
luz.
sale, nada más es para tener bien la luz.
Sí.
¿Lo puede voltear, por favor?
Soy de la ciudad cercana a nosotros, se llama Chalcatonco, y el pueblo de donde soy yo, Chapultepec. Ajá,
¿Y es al norte, al sur?
Casi al sur.
Oh, pues ya pegado a Guatemala, entonces.
No tanto,
No
bueno,
tanto.
casi un poquito por el centro, pero por el west, como
Sí, sí.
cerca un poco de la playa, pero no tan cerca, porque
Sí.
muchas personas dicen, oh my God, Oaxaca me encanta, tiene muchas bonitas playas. Pero cuando eres ahí y eres pobre, nunca visitas, ¿verdad?
Claro, no puedes viajar a la playa.
Sí, estaba hablando con mi compañera de trabajo de que muchas tragedias han pasado en mi vida y siempre eran las cosas de que no me motivaba a hacer cosas, pero empecé como voluntario en la organización que estoy ahora. Y digo, oh my God, hay muchas personas que están lidiando con muchas cosas todavía. Y me siento muy privilegiado en la posición que estoy de ayudar. Es algo de que me recuerdo todos los días y también como en estos momentos. Nunca yo me imaginé estar en un lugar así y me siento bien privilegiado. Oh my God, no puedo creer que yo estoy en esta posición. Es algo que me motiva a trabajar.
Qué bueno, José. Bueno, pues si quieres...
¿Ya estamos listos?
Sí,
Uh-huh.
okay.
Voy a aplaudir
Muchas
nada
gracias.
más una vez para marcar el audio. 1, 2, 3.
Pues me vas a ver.
Uh-huh.
Entonces, si me puedes decir cuál es tu nombre, cómo se llama la organización, dónde estás.
Mi nombre es José Mendoza. La organización que yo trabajo se llama Casa Latinos Unidos y estamos localizados en Corvallis, Oregon y en Lebanon, Oregon. Tenemos 2 oficinas, pero somos flexibles, podemos intentar conocer, ver a los clientes en el condado de Lynn y Benton. Si hay un espacio, podemos intentar verlos ahí.
Ay, qué bueno. ¿Y cómo tu organización ayuda a las comunidades para que puedan tener acceso y navegar el sistema de salud que es tan complicado y cómo puedan entrar y usar el OHP?
Nosotros, todas las personas de la organización son bilingües y son inmigrantes de primera generación o segunda generación. Hablamos el inglés y español. Intentamos siempre de las personas explicarle los beneficios y sí es muy difícil navegar el plan de salud de Oregon, pero intentamos como simplificarlo un poco y luego ya que expliquemos como qué beneficios calificaron, cómo le podemos ayudar y luego después ellos nos dicen, ok, si puedo hacer esto otro y ahí le intentamos explicar un poco más, pero intentamos darle tiempo para que aprendan un poco y luego si tienen preguntas luego nos preguntan.
Muchas gracias. ¿Y en qué lenguajes ustedes ayudan a la comunidad? ¿Cuáles lenguajes?
Ayudamos a la comunidad. Nuestro lenguaje primario es español, es lo que la mayoría de nuestros clientes vienen y nos piden ayudas en español, pero todos somos bilingües, podemos cambiar de español a inglés muy rápido, pero la mayoría de las personas son de habla hispana. Sí hemos tenido otras personas de habla idiomas indígenas como el MAM, como personas de Guatemala. En estos momentos estamos intentando trabajar a cómo mejor ayudar a esa comunidad, pero usualmente cuando hemos ayudado a alguien así, trae a un familiar que le ayuda a interpretar.
Muchas gracias. ¿Dónde, tú ya me dijiste dónde está localizada tu oficina? No me tienes que dar la dirección precisamente, pero ¿en qué ciudad está, como ahorita lo dijiste? ¿Y qué áreas sirven?
Nosotros estamos localizados en una escuela que se llama Garfield en Corvallis, Oregon, y ayudamos los condados de Lynn y Benton, que incluye las ciudades de Albany, Lebanon, Sweet Home y los alrededores, y luego en Benton County es Corvallis, Paloma y Monroe.
Muchas gracias. ¿Cómo te encuentran a la organización? ¿Cómo los encuentran la comunidad? ¿Cómo se dan cuenta que ustedes existen?
Algo que hacemos mucho es participar en eventos y nosotros también hemos creado eventos. Cuando vamos en eventos llevamos nuestro señal y dicen nuestro número telefónico. Tenemos una página de internet y tenemos una página de Facebook por si las personas nos quieren contactar ahí. También traigo mis tarjetas conmigo y los paso mi tarjeta. Tiene mi número de teléfono de trabajo, pero también tiene el número de teléfono de la oficina. Los clientes me pueden llamar a mí directamente si necesitan ayuda con el plan de salud de Oregon o llamar en la oficina y por si necesitan otros recursos que proveemos.
Muchas gracias, José. ¿Y cuál ha sido tu mejor experiencia con el programa para OHP?
Mi mejor experiencia con el plan de salud de Oregon ha sido de que tuve una familia que vino de Washington. Ellos emigraron de México a Washington y de Washington no consiguieron trabajo, se vinieron para Oregon y se vinieron en una de nuestras... estamos localizados en un departamento complejo de Colonia Paz y vinieron a moverse ahí y se conectaron conmigo. Dice, hey José, escuchamos que tú nos puedes ayudar con el plan de salud de Oregon. Por favor, nos puedes ayudar para que mis hijos puedan ir a la escuela. Y los ayudé a conectarse con el plan de salud de Oregon, a agarrar los beneficios y luego les ayudé a que sus hijos agarraran las vacunas que necesitaban para ir a la escuela. Y me hace muy feliz cuando veo una familia que dice, es que no tenemos transportación, ¿no? ¿Cómo ir a la cita? Y le digo, con el plan de salud de Oregon, ustedes pueden agarrar transportación y vienen a recogerlo en su hogar y llevarlos en su cita. Y se me hace, es casi una de las cosas de que me encanta más decirles, sí, no tienen que pedirle a su esposo o alguien más que los lleve, porque hay un programa, hay un sistema de que los puede llevar a sus citas.
Qué bueno. Y ya, yo sé que ya me dijiste con tu historia que te motiva, pero si puedes hablar otra vez, ¿qué es lo que te inspira y te motiva para que tú, José, te levantes todos los días y puedas seguir ayudando a tu comunidad? ¿Qué te motiva?
Sí, algo que me motiva hacer el trabajo que hago. Primero, me encanta el trabajo que hago. Me comunico con familias nuevas casi todos los días. Familias que necesitan como encontrar un servicio. So, cada vez que consigo una familia, digo, ok, ¿cómo le puedo ayudar a esta familia al día de hoy? So, eso me motiva. También la igualdad. Pienso que como yo fui un inmigrante que vinimos aquí en los Estados Unidos y luego se nos hizo muy difícil adaptarnos aquí en Oregon y hubo un trabajador de salud que nos ayudó en esos momentos. Entonces yo quiero ser ese para las familias, ayudarse, adaptarse un poco mejor y qué mejor manera de informarles sobre el plan de salud de Oregon, porque muchos casi ponen su salud secundario. Primero dicen, oh, necesito que trabajar, pero ¿cómo pueden trabajar si no se están cuidando a sí mismos? So, es lo que me motiva a dar información para la comunidad y ayudarles de que practiquen salud preventiva. Muchos nomás dicen, oh, pues yo no necesito, pero hay que practicar salud preventiva porque es lo que nos va a ayudar a trabajar en el futuro.
Qué bueno, José, pues muchas gracias. ¿Y eso te hace muy feliz?
Así, ayudando a la comunidad me hace muy feliz porque me hace recordar cuando yo vine y digo, si hubiera más personas que sienten pasión por su trabajo y nos ayudan, quiero hacer eso para las nuevas familias, de que, hey, aquí estoy para ayudarles y pregúntenme y si no tengo la respuesta voy a intentar lo mejor para buscar esa ayuda para ustedes.
Muchas gracias. Y por último, si pudieras describir con una palabra, una sola palabra, esta experiencia de OHP, ¿qué palabra pensarías?
Es difícil. Pienso que es igualdad. Es la palabra que el programa de Healthy Oregon ha traído, un poco de igualdad.
Muchas gracias. Pues ya es todo. Muchas gracias. Sí.
Nada más, José, si pudieras como invitar a las personas a que
se inscriban
aprovechen este programa.
Sí, el plan de Oregon antes tenía unas restricciones debido a sus edades y sus, El plan de Oregon antes tenía unas restricciones debido a sus edades o situación migratoria, pero a partir del julio 1 del año pasado, 2023, ahora todas las personas pueden aplicar. Pueden aplicar y luego ver si califican para el plan de salud. Lo único limitantes es sus ingresos, pero hay que decir si no calificaron un mes, pero posiblemente pueden calificar el próximo mes. Al no calificar significa, oh, ya nunca voy a calificar. Significa de que quizás en el mes trabajaron mucho más si es por situación económica. Los invito a todos de que practiquen ayuda preventaria para que cuidarse su salud en estos momentos, y el plan de salud de Oregon es algo que les puede ayudar con eso.
Muchas gracias. Anything you want to share?
Good. Yeah, I don't know, Burma, Myanmar? So Myanmar is between China and India, so I came from there, tiny country, and we are kind of like military government right now. So that's why a lot of people run away from the country, from the military regime, to flee from the country. So I came to the United States as a refugee in 2015 with my wife, daughter, and now I have 3 kids. So yeah, we are kind of like international family in my own family. So we born in Burma, my daughter born in Malaysia, and 2 of them born here. So kind of like real international family. So yeah, I am a refugee, and we are kind of like a very small community in Portland. And yeah, I've been working with ERCO since ERCO is my first employer in US since like 2015. So I've been there for my first job is ERCO. So, and I'm ERCO client too. So, yep, that's how. Yeah. Mm-hmm.
Oh, that's good. And what language did you speak between English and what language you spoke in your?
It's a good question, and it's kind of like in my community itself, we have kind of like in one state, like Oregon State. In my state, we have 35 different languages, which kind of like we don't really understand each other. And my mother tongue is Zomi, which is kind of like the majority language in the Northeast in Chin State. And my second language is Burmese, which is the national language in Burma. And it's kind of like totally different language. And Burma script is like different, and Zomi language script is like we use English alphabet. And by the way, it was created by American Baptist missionaries like 100 years ago. And I also stayed in Malaysia before I came to the US for 12 years. So I also speak Malay. So that's my third. Of course, English will be my third, and that will be like my fourth language. So I speak like different, 4 languages.
Wow.
Understand, yeah.
That's so interesting.
Mm-hmm.
And the language are very different from each.
Yeah, each of them come like very different, like especially I think English and Zomi is kind of like the way that Spanish and English, whatever you translate from the back to the front, right? So we do the same thing. So like, I want to see you, if I say in direct translation, you see one, like that kind of translation that we, from the Zomi, when I translate directly into English, you see one, something like that. So it's kind of like very difficult, especially when I do like consecutive translation. My head is spinning at the end.
Okay, thank you.
I'm just gonna clap really briefly so we can mark this out. Okay, 1, 2, 3.
Thank you. Francis, I know your name is Francis, but I need you to tell me what's your name, and the first 2 questions, and what organization are you with?
First, thank you for having me here, Victoria. And my name is Francis Kam, and I came from the small country, Burma, which in between India and China, and we call it now Myanmar. And right now I work with IRCO, Immigrant and Refugee Community Organization, and that is my first employer since I came to the United States as a refugee in 2015. So I've been there for the last almost 9 years, almost 10 years.
Wow, thank you. How does your organization, how does IRCO support community members trying to access or navigate OHP?
As a refugees and immigrants organization, we kind of like mostly work with the refugees and immigrants communities across, I would say, from around the corner. And it is kind of like our privilege as IRCO. We will be able to serve those who come to Portland as a refugee or immigrants. And there's a lot of system that they kind of like, as for myself, I didn't understand at all. So IRCO provide a lot of cultural specific navigations for example, in this case, OHP, Oregon Health Plan, and a lot of things that we don't see in my language, but through the OHP sisters, I can get a lot of information. And we have community event. We have community we go around in the Portland area, and we provide tablings and sharing information. Of course, we do have monthly clinic at IRCO, and we provide enrollment and also Oregon Health navigations, system navigation within either individual or within the group or within the culture specific. And also we do have outreach program, internal outreach. We share this information with other department, or also community outreach. We do a lot of outreaching for this project as well. Mm-hmm.
Well, thank you. The other question is, what languages IRCO is able to offer to support the OHP?
Right now, in terms of the sister, we do have Asian culture-specific OHP sister, which she speaks Vietnamese. And also we have another sister from Somali culture specific, and also we have Slavic sisters from the Slavic community, but not limited to. We serve any other community members. We do partner with We have international language bank in Ergo that's provide translation and interpretation. So anyone comes to our door, we have access to provide, with interpretation, and we provide any cultures that come to our door. As I mentioned earlier, we have a lot of international community come through our door, and we can, we serve any non-limited any language that come to our door. Mm-hmm.
Well, yeah, that's a very good benefit of IRCO because they have all these interpreters and translators.
Yeah, sure. Mm-hmm.
Oh, thank you. Where is your office located and what areas do you serve from the state?
So Ergo started in 1970s, and we expand like up to many years. In 40 years, after 40 years, we spend a lot, expand to, right now we have Ergo Meng, which is our headquarters in Portland. And also we do have another house, Centers Africa House, we call it specifically for Africa community that comes to Africa House for any resource. And we also do have like Eastern European Community Center, which basically serve focus on Slavic communities across in Oregon as well. And we do also have the GMEC called Greater Middle Eastern Cultural Center, which focus on Middle Eastern. And of course, we do also have the Pacific Islander Asian Family Center, which cover like Pacific communities and Asian communities that come and look for different resources as well. And also we do have another location in Ontario, Eastern Oregon, that's we have another small office there, which is kind of like serving the Eastern Oregon communities there as well. And with that, we have kind of like expand quite a lot of different culture centers within Oregon as well. Mm-hmm.
Oh, well, we're going to visit Ontario.
Oh, sure.
Yes,
Yeah.
on Thursday. The sound was okay, Pablo?
A little bit loud, but
I can tell them if they can stop for a few minutes. It's
Yes,
still
only
rolling.
for 5 minutes.
Yeah, it's still rolling. Okay.
Okay, there's almost we finished, but how can community members contact you? How they know about you, the OHP? What did you do to communicate the community that you can help them with OHP?
The OHP, we do tabling, outreach in different places, and also we do have like social media, and we do have kind of like WhatsApp or the Viber to reach out to the community members, and we have very specific email that we can provide to the community member that they can reach to us with any language. Like we do have like health plans at IRCO, health plans, PLANS at irco.org. So sometimes we receive Spanish, or sometimes we receive Ukrainian language that come through our door. And we have a team that speak different languages in our team that, like, for example, Spanish, we have someone that speaks Spanish and she can translate. And we have Russians or any language that come to the email. We have someone always be there to translate for us. So anyone can send to any different language that they understand and they can write, and we can find out what they really need. So we have also we provide a phone number, and I forgot that number. That's mine, so I can give it to you. Yeah. Mm-hmm.
Yeah, don't worry. Thank you. What has been your best experience with this program, OHP?
OHP in the past, as a refugee myself, when I came here, just OHP. Insurance, like insurance is a big term for us to learn, especially insurance is like, we heard about insurance is something like die or, death or something like that. But when we talk about OHP, it's kind of like health insurance, and basically the country that I came from, we don't have any insurance at all. And when we go to visit the doctor, we just pay as it is, and it's expensive, by the way. And we don't normally go to visit the doctor office unless we are very, very seriously sick. That's how we approach the doctor. But here, I remember when I came in here, I have to get some vaccinations and all this and that, like refugees intake and all. So we understand that this is very important in the first place, and we didn't know how much they spend. Like when I visit to the hospital, I don't know how much I spend, but for sure, that's the money that they charge, which cover a lump sum money, which I cannot pay. So that's why it's attract to us, like when it talks about insurance, which we never know in my home country. So it is very for us to, a lot of people also didn't understand about insurance, and there's a lot of benefit within the insurance plan. So ergo, we navigate all those systems, and sometimes those who are healthy, not much an issue, but those who are kind of like often need to required to visit the hospital, there are a lot of benefit within there. And like, let's say we talk about last year, like we have the weather problems, this and that. Some of them very kind of like in the sunny, like the temperature, when it goes up, the temperature is so high, and they don't know anything. And then there's a lot of benefit within what do you call the health insurance, and all those things. We navigate the system, and also like we didn't know about transportation. We relies on the caseworker, or we relies on relatives or someone else. But now here we are, the transportation. What about interpretation? We didn't know about that. Now a lot of people in the past, like for my case, I asked someone that speak English, or maybe other community members asked me to go with them because they trust me. But now when we know about, there's interpretation, because when I go with them, I have to take a job, like from my work, and I have to follow with them. But now when they realize about, there's interpretation, so they are kind of like more free to choose dates and time that works for them, especially for the appointments or like healthcare that they need, which is amazing for us to support those who really don't understand the information or the system. That we are there to provide for them. So which is like amazing, I would say a rewarding or blessing jobs that we are doing at Ergo. Yeah.
Thank you. Let me open to Oscar. Let me, and then that way he knows that he can come. Oscar?
Is there any way I can add my phone number? I forgot.
Sure.
No,
Yeah.
sure. Don't worry, we're gonna ask you for that information.
Yeah, we want to ask you. We will. It's
Yeah,
okay.
we're gonna add it to the video.
Yes.
Yeah.
And there's only two more questions.
Okay.
You're pretty good. The two more question is, what would you say to somebody that is afraid to use OHP, and you wanna give him like a short message to motivate them to learn about OHP benefits? What would you say?
It's kind of like the same thing we talk about. In back home, we don't have insurance, and but here when we have insurance, a lot of people like the term insurance is like there is some fee attached, but it's I would say it's free of charge. I would say you don't need to pay. And it gives you health, and it gives you mentally, physically, relief what you currently facing. Like for example, whether they are healthy or whether they are, unhealthy community members. It's kind of like you should have this kind of insurance for in case it could happen anything, and it's free of charge, and we are here to help. So I would say that's a message to the community members.
Thank you. And the last, I don't know, is that? ¿Está bien? Sí. Sí. The last question is, Francis, what motivates you to do this work? What inspires you? What do you think in the morning when you wake up and you have to serve these people, support these people, be patient, listen to them, to their stories, connecting to the services? What really moves inside of you that makes you do this work?
It's kind of like we are BIPOC, like we serve refugees and immigrants community. And as myself as a refugee also, sometimes I feel like other people, I help my own community, which is a blessing for me, as well as I get paid to do all this job. And I have a lot of the same very situation experience in the past. So like every morning, when I get up, before as soon as I open my computer, today what I do for, what is the great day to do something for my own people or my own community, That's always inspire me to do early morning. And also like when, there are a lot of people, they don't know they are struggling and they don't know any, probably they know, but they don't know where to get it or where to get information. That's where we are, step in to provide all those like the gaps for the community member, especially the people that we serve. And also, it's always, for me, working as in ERCO for the past, like as I mentioned, my first employer, I like the people that we serve in ERCO. That's make me motivate for me every day that the work that we do. And of course, as ERCO as organization, it's kind of like we are helping people every day in different capacity. We have like a lot of programs, a lot of department, and every day ERCO is doing something good for the community, and that's what we are there. That's make me motivation to be at community health worker as a staff at ERCO as well.
Thank you, Francis. And if I was here and you want to tell me to sign for OHP and a close message in any other language that's not English, what do you say to me?
Tu ni hilai mo na chidam na to ke saina nang amok na kinga thehi mo ina nang peding kharzok omlo ung pain la angenin chano dima insurance ka chama insurance ka chano alakaya shi ni bare so ro khamya ni ne ba ma pe se amlo bu chano ro dima kungi pu sindin shi de arko mala khe ba.
Thank you. And what do you say?
We are here to, if you health insurance, we are here to help you, and you can come. It's free. What is one in Zomi and one is in Burmese. So yeah, reach out to my own community through your network.
Thank you. That's beautiful. And
Yep.
if you were gonna choose a word, just one word, think about it, to say what this means to the community, what it is for you, what word would you choose?
Blessing. Yeah, I would choose blessing, and because those days, we come like refugee. When we get a job, we just tiny over income. We lost that, but now Healthy Oregon, through Healthy Oregon, the income limit is increasing, and that's make a lot of community member eligible. Not only eligible, when they eligible, they don't scared to go to hospital, dental, vision, physical, and everything they have access, which mean like, according, like the logo says Healthy Oregon. So I would say the community are healthier, blessing and healthier.
Thank you. Muchas gracias. Thank you very much.
Thank you.
It was pretty good.